next, I was wanting to ask you this. I wanted to take your discussion to the novel markers. This is straightforward from the European guidelines, and believe me, they are asking on this. Once the discussion is on the core hematuria, if the 10-minute station is core on the core hematuria, then cytology can be a discussion for 2 minutes. They can ask you about the novel markers, and believe me, you mentioned about the ADX bladder. You can mention, you should remember at least two, three, or at least a few more. So epi check is important. So you can remember it like ADX, A, remember it, epi check, AP. Okay, so and X for expert bladder. So at least we can remember expert bladder, epi check, and ADX by just remember ADX. So you mentioned ADX, A, epi, X, expert. So just remember it like that. At least in the Viva we can mention 3. For your MCQ exams, those who are writing the part 1, please remember the marker with the highest sensitivity is the TERT, FDG, FR, TERT. This is a reverse transcript test. The other option can be a reverse transcript test, and this is the reverse transcript test, which is a 93% sensitivity. Remember it, very important. And the highest specificity is EpiCheck. So these two are important. Now they might ask you again in your Viva, in your MCQ, whatever, what is the current role of markers? They're not used for diagnostic. The current value is very low for diagnostic. They're mainly used for surveillance. They have been approved now. This is the meta-analysis published in 2021. They have been approved for surveillance, but they're not approved for their diagnostic purpose. So in the diagnosis, you cannot say it's important, but in your follow-up, you can use it. It's very important, novel markers. So this image we have discussed, you mentioned all the points. Okay, we just quickly, papillary tumors, multiple tumors involving all the walls of the bladder. This appears to be non-muscle invasive, but it's very, we need to look at the other images to confirm that. So, okay, so that much is enough. You can't comment a lot on this. The orifices are not visible. You mentioned it correctly. So enhanced cystoscopy techniques, we already mentioned this. So you mentioned about the PDD and the narrowband imaging. So these are the other techniques the examiner might be wanting to hear. Okay, the 3 other techniques is optical coherence tomography, confocal laser endomicroscopy, and Raman spectroscopy. Just the names. OCT, what does it do? Coherence tomography, it does the histopathological evaluation. Endomicroscopy, it can differentiate between the low grade and high grade based on just cystoscopy. And spectroscopy, again, you don't have to remember the basic mechanisms for this, but yeah, for this too, you mentioned it. Remember the wavelengths, remember the mechanism. So for a PDD, an abnormal tumor the tumor will appear to be red fluorescence. Okay. And for narrowband imaging, remember there are 2 different wavelengths. So at what is the normal tumor going to? So there is going to be a green color, there is going to be a brown color. The 2 different colors which are produced when you put a narrowband imaging. They are going to ask you, okay, which one is the tumor? So green is good, brown is bad. So brown is the tumor, green is not the tumor, the normal thing. So narrowband imaging, you put the 2 different wavelengths, and so you can memorize the wavelengths. One is around 400, other is around 380 something. And you put the wavelengths, you get 2 different colors, and the green is the good one, you don't resect that. Brown is the bad one, you resect that. So this is something I wanted to ask you. Next was, what is the current value? This is the latest evidence on this photodynamic diagnosis, and it was it is known as the photo trial. Okay, the photo trial is very commonly asked in the exam. Why? Because anything which is published in New England Journal of Medicine recently can be an exam question, and this is published in the New England Journal of Medicine in 2022. What does it say? That this is the photodynamic diagnosis does not reduce the recurrence rates, and neither it is cost effective. Okay, so this is very important for you to understand that this is the current evidence on photodynamic diagnosis. They will ask you, believe me, they are going to ask you this. Okay, so we are going to continue It's already 10 minutes of discussion, 12 minutes of discussion. Okay, we are going.